Hi, good afternoon, everybody. My name is Jessica Barba Brown, and I am the Senior Advisor for the Healthy Democracy, Healthy People Initiative. I want to thank you all for coming to this webinar today, Voting and Health, Expanding Opportunities for Inclusion. This is a companion webinar to a webinar that we presented on August 31st, which was called Voting and Health, Evidence and New Tools for Action. In that webinar, we really explored what is the link between voting and health. Why are these two things so linked? How can we use civic participation to advance our health equity goals? And what are some tools that we can use to help do that? And so today we're going to be taking a deeper look into this idea of inclusion, which is that when people feel that they have a seat at the table, when they're able to express their voices and their opinions through the ballot box, that we really have more equitable and healthier communities. And we know that communities that are healthier, they vote more, and that for communities that vote, they have better health outcomes. So it's really a reinforcing cycle, and we're really going to get into that today. I'd like to thank all the sponsors of this presentation, the American Public Health Association, Vote ER, the Network for Public Health Law, and the Roundtable on Population Health Improvement at the National Academies. We absolutely appreciate all of these groups coming in this presentation with us, as well as our fabulous speakers. So just to recap about the Healthy Democracy, Healthy People initiative, this started in 2020 as Vote Save Public Health and We Can Vote. We saw that the COVID-19 pandemic was going to affect the elections in ways that we probably didn't had ever seen before. And so we brought together public health experts and civic engagement experts to make sure that the elections were safe, secure, and successful. In that work, we really realized that this was a link that went a lot deeper and a lot more beyond the pandemic, which is that we need to ensure our health by building our collective capacity to act, our power. And that is what we are dedicated to as a coalition, and what we're excited to bring this webinar to you today. We also see that because of the increasing threat of COVID-19 variants, we also have continued barriers to voting for disabled folks, for immunocompromised folks. So we really still need to bring health and voting experts together to provide options for safe and healthy voting. So the research that we presented in this August 31st webinar, which you can certainly view and see the slides and the presentation from that, was about our first analysis called the Health and Democracy Index. What this is an analysis comparing 11 public health indicators along with civic engagement indicators for all 50 states and DC. And what it shows is that states with more voting access and better civic participation have better health outcomes. And that's why today we're going to be taking a deep dive into how can we close the civic participation gap, not only because it's important for so many issues that we care about, but really that it will make our states and our communities a lot healthier. So we know that for certain communities that they face more barriers to voting, and they also face more barriers to health equity. Despite record turnout in the 2020 election, approximately 1/3 of eligible Americans still did not cast a ballot. And historically, turnout is lower for Latino, Asian American, Pacific Islander, and American Indians, as well as for younger voters, voters with lower education levels, and low-income voters. People experience barriers to registering to vote and casting a ballot for many reasons, including the lack of identification documents, frequent changes in address, limited English proficiency, misconceptions about the rights of people with disabilities to vote, and voter registration. And that's really what we're going to be focusing on today, is this first most important step, voter registration. When asked why people did not vote in the 2020 election, for people that sat it out, not being registered was the main reason that voters cite. And so we see that patterns continue in terms of correcting the disparities in civic participation and in health equity. I want to make a point here that voting is a nonpartisan activity. To vote is to be heard at the ballot box, to be heard in your community, to feel inclusion. And that is a right that every single American is entitled to. And we want to ensure the greatest participation among all eligible Americans. And that is what we're talking about today. I want to quote Dr. Georges Benjamin, who's the executive director of APHA. He actually concluded the last webinar on August 31st with this quote, which is, "Voting is basically the ball game. It's the most important public health intervention that any of us can do." So we're talking today about how do we correct this gap that we see in participation, and looking specifically through the lens of voter registration, which is really the first and most crucial step to participation. We're also going to learn what health and public health professionals can do to encourage and promote voter registration among underrepresented populations, and specifically those enrolled in Medicaid, which is going to be a big focus of the presentation today. So with that, we can get started, and I would like to introduce our first speaker, Neil Ubriani, who is the Policy and Research Director for the Center for Secure and Modern Elections.
Thanks, Jessica. Can everybody hear me? Great. So as Jessica mentioned, I'm the Policy and Research Director at the Center for Secure and Modern Elections. We're an organization that works on voter registration modernization policy at the state level, trying to find registration policies that make voter registration more efficient and more effective. And so we spend a lot of time thinking about who is and who isn't registered in America. And so as Jessica mentioned on that point, you've got sort of a population of people who are currently registered, and they've sort of got that gateway to participation, and people who aren't currently registered. And so this is data from the 2020 census. 72.7% of US citizens are registered to vote. That's up from 2018, when about 67% of people were registered. So we're seeing improvement in the registered voter population, but there still is about 60 million unregistered eligible people in the US. So, and this 60 million number and this 73% registration rate, it varies a lot by state. It's important to emphasize. You know, you've got some states that have 85% of their eligible voter population registered, states like Minnesota. And then you've got states that are in the low 60s in terms of the registration rate of the eligible population. A state like Arkansas, for example, is in the low 60s. Also within the 73% registration number, you've got a lot of variation in terms of demographics. So young people are far less likely to be registered. Among 18 to 24-year-olds, about only 60% of people are registered to vote who are eligible. As age increases, that likelihood of being registration increases substantially, so that 65 to 74-year-olds, almost 80% of them are registered. On gender, there's also a slight gender gap in registration. Men are less likely than average to be registered. Women are slightly more likely than average to be registered. And on race, you do see substantial differences. The white registration rate is 76.5%. Among Black eligible voters, it's 69%, drops down to 64% for Asian, and for Latino eligible citizens, it's about 61%. And so when we think about this population of who is registered to vote and who isn't, and sort of the disparities that exist in this population, it's important to think about the sources of voter registration and how people actually become registered in the US. And so there's 6 main sources of voter registration. There's in-person voter registration, which is you sort of walk your voter registration form into the county clerk's office, or on election day, if a state has same-day registration, you can register at the polls. There's mail registration, printing that form off, filling it out, putting a stamp on the envelope, and sending it in. There's online registration, which is similar to mail, but you fill out the form online. There's DMV registration. This is the motor voter concept. When you go to the DMV, you get offered the opportunity to register to vote. There's other government agencies that are required by law to offer voter registration. And then there's registration drives, sort of private registration efforts. These are folks outside the supermarket or at a community fair with a clipboard, sort of trying to get people to register to vote. And so with this list in mind, just as a little exercise in your head, think about which of these is sort of the number 1, number 2, number 3, if there was a pie chart of how people got registered. And so take 2 seconds to think that number, and I'm going to pull up the actual results from 2020 of how people got registered. So DMVs far and away are the #1 source of registration. It's almost 40% of voter registrations come through that DMV motor voter process. Online voter registration is sort of a near second, about 30%, and then there's a real drop off. About 13% come through mail. In-person voter registration is about 8%, and then registration drives and other government agencies are down at the bottom, registering sort of a small percentage of people comparatively. And so in thinking about sort of how we get the population of people who are registered and people who are not registered, it's useful to think about how people are being funneled into that process. And so thinking about who DMVs and online voter registration actually get on the rolls. And so for DMVs, if you had to pick one agency to do voter registration, DMVs are kind of like the perfect agency. They reach 90% of the population, people getting a license or ID, and the information you provide for a license application, your name, your address, your date of birth, these are all the kinds of things that inform a voter registration application. And that's why since 1993, federal law has mandated a motor voter process for people conducting a license or ID transaction at the DMV. And that federal law mandates that the voter registration process has to be integrated into the license and ID application. They can't just sort of hand you a separate voter registration form at the DMV. If you're providing information for your license or ID application, they have to carry that over to your voter registration application. You can't enter your name and your address and your date of birth twice. This federal minimum is just an opt-in voter registration. You have to be offered sort of a checkbox that says, I want to register to vote. Please use the information I'm providing today to register me to vote. But that's sort of a federal floor. And what states are doing, and what's really sort of supercharging the DMV as an engine for voter registration, is taking this federal floor and sort of flipping that presumption to an opt-out model. If the DMV has everything they need to register you to vote, they know you're a citizen, they have your name, they have your address, they have your date of birth, they're going to say, we're going to register you to vote today using this information unless you decline. And so rather than people having to affirmatively select voter registration to say, yes, I want to be registered, it's sort of an opt-out model. People say, you can decline registration, otherwise we're going to register you. And this is what's known as automatic voter registration, or automated voter registration is what some states call it. The idea that eligible citizens at the DMV are registered unless they decline. And this is really a new innovation. Oregon was the first state to do this in 2015. And since then, it's kind of spread across the country like wildfire. Since 2015, the states in green have launched AVR, and the states that are in blue have passed laws to enact AVR and in the process of implementing it. And as I mentioned, this is sort of what's turning the DMV from sort of a very strong engine of voter registration to sort of the most powerful engine of voter registration, because more eligible citizens who are interacting with the DMV are being registered to vote based on that interaction. The other main source of voter registration is online voter registration. Online voter registration is passed in 42 states and the District of Columbia, and like automatic voter registration, it's on sort of this path of rapid expansion. OVR started, I think, about 2 decades ago, and it sort of jumped to 42 states, 14 states since 2016 alone. This is sort of a paperless process. It's much more efficient than mail registration. The limitations of online voter registration are that it requires access to the internet. And in most states, it requires the person registering to vote online to have a DMV issued ID, like a driver's license. And the reason for that is when you're filling out a form online, they can't typically collect a signature from you, sort of an image of your signature that can be used to validate your mail ballot or can be used when you're checking in to register to vote. And so what states typically do is they will say our OVR system is only limited to people who we can pull a signature from the driver's license database. So if you have a driver's license in your state, you can submit the online voter registration form with all your information about your address and your name, and they'll pull your signature from the DMV database. If they don't have a signature on file for you in the DMV database, then you can't use the online voter registration website. There are some states that have sort of gone above and beyond this and let people upload a signature. For example, they let you sign a piece of paper and take a photograph of your signature with your phone. but that's really the distinct minority of states. This map shows states with online voter registration. The blue states are ones where it's restricted to only people with a DMV issued ID, and the green states are the ones where it allows signature upload. And so the point, AVR and OVR are sort of these very powerful mechanisms for registering people to vote. They've sort of done an excellent job at getting a lot more people on the rolls. They have an extremely wide reach. 90% of the population has a DMV issued ID, and they're sort of very secure processes for registering people. At the same time, they may be contributing to those disparities that I talked about at the beginning. People with DMV issued IDs, they skew wealthier, they skew older, they skew non-urban. People who are disabled generally don't have DMV issued IDs. And so I think the question to ask is, AVR and OVR are great for sort of 90% of the population, but how do we reach that remaining 10% of the population? And not reaching that remaining 10% of the population may be what's creating these disparities that we see in the registered voter population on issues of age and race. And so thinking about sort of what are the remaining options for reaching this last 10% of people who don't have that DMV issued ID. There's mail, which can be kind of cumbersome, sort of filling out a paper form. You need to have a printer. You need to sort of you need to put a stamp on it. In-person registration, it works. I think it's useful as an election day mechanism. I think before election day, asking people to drive to their county clerk's office to submit a form in person can be kind of difficult, and not all states have election day registration. Registration drives are great. I think it just depends on private resources. It's sort of investment of people to say, to go out and register. It's not really a state-based mechanism for registering people to vote. And so I think the remaining option, and one that is sort of underexplored and underutilized, but really has a lot of power to register people who are being left out by the DMV, is other government agencies. And I'm specifically referring to public assistance and disability agencies. These are also required by federal law to provide voter registration. And public assistance agencies is extremely broad. It's Medicaid, it's SNAP, it's TANF, it's all the major public assistance programs at the federal level, as well as state public assistance programs. It's also disability agencies. It's any state-funded program that primarily provides services to people with disabilities. And so as I'm describing this, you may be asking yourself, this sounds extremely broad. Why is this only registering 1.7% of the registrations that come through? Why is this such a small share of registrations? And the answer to that is that the federal minimum is sort of even more bare than the DMV minimum. This is actually, people can just be provided a paper voter registration form in a stack of eligibility determination. So when you're going in to enroll in TANF or SNAP, they hand you a big packet of information. They can comply with the federal obligation just by slipping a voter registration form in there. It doesn't have to be an integrated voter registration transaction. And the other thing I'd say is, honestly, with so many agencies covered, that's a lot of agencies for groups to monitor and to ensure compliance with. And so things sort of slip through the cracks, and you generally see poor compliance with these voter registration mandates at public assistance and disability agencies. And so I think there's a real opportunity here to sort of expand the model of voter registration at these public assistance agencies to reach people without DMV issued IDs. I think the speakers that are going to follow me are going to talk about how states are looking to extend that automatic voter registration model that we've seen at the DMV to other agencies, particularly these public assistance and disability agencies. And I think that this is really sort of the most promising path for reducing those disparities in the registered voter population that I highlighted at the beginning, and making sure that sort of our registered voter population mirrors the population at large, and ensures that everyone has that opportunity to participate at the ballot come election day. And so, Jessica, I think I'm going to turn it back to you at this point.
Great. Thank you so much, Neil. Great presentation. Now I'd like to invite Dan Muse. He is on the faculty of the Center for Health and Wellbeing at Princeton University and a founding partner of Olden Street Advisors. Dan, thank you.
Thank you, Jessica, and hello, everyone. It's great to be here today. So I wanted to talk more about Medicaid and understanding how the program of Medicaid works and why, as kind of both Neil and Jessica have mentioned, it represents a really kind of intriguing option for states who are looking at automatic voter registration systems and reaching more of the eligible but unregistered population. So Medicaid is a health coverage program with a number of populations that it serves, and it can be a very wide array of folks. Medicaid covers low-income children and parents. Sometimes you'll hear kids covered in what's called the CHIP, or Children's Health Insurance Program, which is run by Medicaid agencies and states. Medicaid covers pregnant women. It covers frail elders, especially frail elders who are of low income. And so Medicaid is the primary source of coverage for nursing home stays, right? And so if somebody is kind of moved into a nursing home, it's likely that Medicaid is paying for that. Medicaid covers health services for persons who are blind and disabled, including those with intellectual or developmental disabilities. In 38 states, low-income adults with or without children, kind of regardless of their parent status, are eligible for Medicaid based on their income. And just to give you a sense what this looks like as far as income, this is somebody who is 138% of the federal poverty level or below. So that's somebody who's roughly making $22,000 or $23,000 a year. So that's kind of who Medicaid serves. And what's important to know about Medicaid is it is a federal state partnership program, right? And so what that means is that states run their own Medicaid program. They receive funding from the federal government, and they have some rules of the road that they need to play by. But states make decisions on how they operate their Medicaid program, how they provide those voter registration forms that Neil mentioned. And what this means is that states who want to use Medicaid as an automatic voter registration agency kind of have that ability. It's also important to know that Medicaid serves both citizens and immigrants. And so as a state thinks about using Medicaid for automatic voter registration, it's important to create protections for immigrant families so that they are able to receive their services, but kind of don't get into a voter registration situation, since immigrants are barred from registering to vote. Understanding, and this is going to be kind of stuff that we've heard from both Jessica and Neil, but Medicaid enrollees and democracy, we know that there are kind of clear overlaps between the populations and communities that Medicaid serves and that benefit from enrollment in Medicaid, and that are most likely to be left off of voter rolls. So we know that people with low income, we know that persons with disabilities, we know new voters, young voters are often left off of voter rolls. One also kind of another population to think about is folks who are on Medicaid have a much higher tendency to move than other Americans. And so thinking about how to get folks who move off and who kind of are transient into a voter registration system that is updated and that keeps them in the most accurate kind of voter registration status possible is really important. Research from Professor Jamila Mishner at Cornell University has actually shown a negative correlation between Medicaid enrollment and voter registration. Right. So what that means is if you are enrolled in Medicaid, you are less likely to be registered to vote. And we think that using Medicaid as an automatic voter registration agency can flip that paradigm. So why do we think about Medicaid for AVR? Well, it's what you just heard from me. Medicaid reaches communities that other agencies might not reach. And so if we're looking at that kind of 10% of the population that don't interact with with the DMV, as Neil just described, it's very possible that included in that 10% are folks who live in urban areas that are highly served by public transit, and therefore don't need access to a car for employment opportunities or for their daily needs. And it's also young folks, folks who are 16 or 17 or just turning 18, who maybe are not accessing the DMV because they don't have access to a vehicle, but they are accessing Medicaid services. As Neil mentioned, Medicaid's already required to assist in voter registration as part of the National Voter Registration Act, and we think there are better ways that they can do it. And Medicaid collects all the necessary information and verifies citizenship, right? So as I mentioned, Medicaid serves both citizens and immigrants, but Medicaid agencies need to know a precise immigration status to enroll someone in the right Medicaid program. And so what that means is that Medicaid knows if a person is a citizen, and that means that we know that a person is an eligible voter. So how might an AVR system work in Medicaid? So you have an individual who's applying for Medicaid for themselves or their family, and there are a lot of doors to the Medicaid program. It could be an online application, a paper application, or a phone application. Any of those applications are going to get the information necessary to kind of apply for Medicaid, but also to register to vote if you're qualified. In each of these application kind of methods, the state collects this information and verifies citizenship through what's called the Federal Data Services Hub. So this basically Medicaid asks the state, they ask the Social Security Administration, hey, I have this person with this information. Are they a citizen? They say they are. And if they are, Social Security says, yes, actually, we have them listed as a citizen. If we know a person is a citizen, that will allow the system to trigger an automatic voter registration and send the required information to voter registration authorities. Where's this happening? So this is unfortunately is not as filled out as Neil's map. The green states that you see here are states that have Medicaid automatic voter registration as part of their statutory process right now. So it's passed in these states. It's passed in kind of different ways and different models in the different states. And not every state is implementing, but we are kind of actively working with those states. Additionally, when states passed that DMV model that Neil was describing, some states also kind of recognize the value of other agencies and the opportunity to have other agencies help with automatic voter registration, including Medicaid. And so those states in yellow are states where the Secretary of State could engage with other agencies to have them become an AVR agency, including Medicaid. And we're working in those states too to help them think about how you might be able to leverage Medicaid as the process. So thank you. I'm happy to answer questions when we get to that point in the webinar, and I'll turn it back over to Jessica.
Thank you so much, Dan. Great. So to look at one of these states and how they are hopefully going to be moving forward in sort of full implementation of Medicaid AVR. I'm going to turn it over to Adam Fox, and he is the Deputy Director at the Colorado Consumer Health Initiative.
All right. Thanks everybody for joining us today. My name is Adam Fox. I am with the Colorado Consumer Health Initiative. And as Dan mentioned, Colorado is one of the states that is moving forward with automatic voter registration and Medicaid. So I'm going to chat through a little bit of what that is shaping up to be in our state. If I can get the slides, oops. Just so that you are aware, sort of CCHI, we are a nonpartisan, nonprofit membership-based organization that really works to improve healthcare access and equitable access to healthcare, really trying to address racial and health inequities in our healthcare system at the state level. So we are not sort of a typical organization that is super involved in voter engagement. We don't do get out the vote or those kinds of things at this point in time, though it is something we are considering. We are fundamentally a healthcare consumer advocacy organization. So where Colorado is in sort of the spectrum on both sort of voting and health is that we are one of those states that tends to be on the forefront as far as inclusive voting policies. We have AVR through our Department of Motor Vehicles. We have same day and election day registration. We have no excuse absentee voting and restoration of rights for ex-felons. But we are still only at 71% of eligible voters being registered. So we know that there is some work that we need to do to reach more of the population of eligible voters and get them registered. On the health side, we are also one of the states that tends to be at the forefront as far as our uninsured rate. Prior to the pandemic, we were hovering right around 6.5% uninsured in our state, so roughly 200,000 or so people in the state. We are one of those states that expanded Medicaid coverage, sort of as Dan alluded to, under the Affordable Care Act. So that covers adults without dependent children. We also cover all of the categories of folks that he listed out as far as Medicaid populations, children, pregnant women, older adults, and people living with disabilities. Colorado also rates relatively well on a majority of health indicators, though, as somebody from our Department of Public Health said the other day, we are winning a race that everybody is losing on health indicators. And so we are looking at how we really improve health equity and access where we need to really stop some of the more gradual progression on obesity and some of those negative health indicators that we are seeing increase here in Colorado as well as throughout the country. So even though we are one of the states that has some of the more inclusive voting access policies, we know that there's a lot of ground that we can cover, and Medicaid AVR may be the best way to do that. So we have 29% of eligible voters who aren't registered, and we have about 20% of the state population, or 1.3 million people, who are covered through our state Medicaid programs. And as Dan mentioned, there are a lot of sort of similar challenges in getting people registered to vote as there are in getting people enrolled into Medicaid coverage. Because they are more transient, because their address changes and notices from the DMV or our Medicaid office or things like that do not go to the right address. And so people fail to update their information and lose either their voter registration or Medicaid coverage because of it. So we know that those challenges align and that there's a lot of correlation between those populations. And really, from our perspective, we see Medicaid AVR as an important racial equity opportunity. We know that among registered voters in Colorado, white Coloradans are 40% more likely to actually cast their ballot. And when we look at the makeup of Colorado's Medicaid enrollees, they are overwhelmingly from BIPOC, Black, Indigenous, and communities of color, with Black residents in Colorado making up almost 30% of the Colorado Medicaid population, when they are about 4% of our state population, whereas Hispanic and Latinx individuals in Colorado make up about 30% of our state Medicaid roll. They are just shy of 20% of our state population. So these are some of the racial inequities, both sort of that we see in as far as health outcomes and voter engagement and registration. And Medicaid AVR is an important tool that we are excited to see implemented in our state. So as Dan mentioned, while some of the states who have passed Medicaid automatic voter registration have put it in statute, they are not fully implemented, and Colorado is one of those states. So we know that Medicaid AVR will build on a variety of robust health enrollment efforts that are happening here at the state level. We have a pretty decent infrastructure as far as benefit processing and whatnot, and with a caveat that I'll talk about in just a minute. And we also have pretty robust networks of folks who are certified assistance sites that can help people enroll in Medicaid, as well as through our state-based marketplace for health insurance coverage. When it comes to some of that infrastructure piece, one of the things that we are sort of bearing in mind here at the state level in Colorado is our benefit management program and system has sort of pluses and minuses to it. It is an older system that is relatively challenging to update. And so implementing a Medicaid AVR may take some time. Right now, our Department of Healthcare Policy and Finance, which oversees our Medicaid program, is looking at implementing the AVR in Medicaid in probably late 2022 or more likely 2023. But we also know that with changes to the system that Medicaid uses, there are often hiccups along the way. And so it often takes a bit of a longer on-ramp for really thorough and good implementation of some of these kinds of changes. On the flip side of that, Colorado's benefit management system for Medicaid is also attached to benefit management for SNAP and TANF and many of those other benefits. So it may, if we are able to implement Medicaid AVR, it may be relatively easy to just implement AVR throughout all of those benefit structures because they all rely on the same benefit management system. From our state perspective, there are some predictions that Medicaid AVR could at least move us towards reaching up to 95% of the voter eligible population for registration. And that means roughly about 385,000 voters that we could potentially reach and get registered. And the vast majority of those people that are not registered that we may be able to reach through Medicaid AVR are voters of color or are young adults. So this is a really important opportunity to close those equity gaps in voter registration and ensure that these populations who also typically are left out of many of the health policy conversations have more of a voice in those because they are actively in the voting population. We know perfectly well that legislators are more likely to listen to people that they know are voters in their districts and who are engaged. And so this is a way to close those equity gaps on sort of the health and health policy side as well. And as various other speakers have talked about, there is a high level of correlation between people who are engaged in voting and better health outcomes. All of these are issues that we are still trying to improve on at the state level here in Colorado, continuing to lower the uninsured, in improving health outcomes and reported health in Colorado, which we have seen some deterioration, particularly during the pandemic around mental health and mental health access. And lower infant mortality. And here is another area where we see very, very stark racial inequities in infant and maternal mortality rates. So all of this, these are issues that we are really working to address through our health coverage and health access systems. But fundamentally, CCHI as an organization, we work day in and day out to really lift up and amplify the voices of consumers to improve our healthcare systems. We work one-on-one with consumers to build up their advocacy skills to help them engage in sort of the policy areas in health that affect their lives. And improving voting access is a fundamental way to improve our healthcare system. It is a parallel system to what we are already doing at sort of the legislative and regulatory level to improve healthcare. So with that, I'll pass it back to Jessica.
Awesome. Thanks so much, Adam. And our last speaker, we will hear from Alex Reardon, who is a Civic Health Fellow with Vote ER. And after Alex speaks, we're going to take some time for Q&A. So if you have any questions, please put them in the chat, and we will get to them after Alex. Go right ahead.
Wonderful. Thank you, Jessica. Can everyone hear me okay? All right. Yeah, thank you, Jessica, again, and for the National Academy for having us and all of our sponsors. And I'd also like to thank the other panelists for their expertise and sharing that with us and highlighting the possibilities in Medicaid, AVR, and all the other OVR, and sharing with us those frontiers that they're working on. As Jessica mentioned, my name is Alex. I'm a Civic Health Fellow with ODR, and I'm also a fourth-year medical student at the University of Michigan. And I'm actually turning in my residency application later today, applying for a spot in emergency medicine. And I'm really looking forward to putting those clinical skills that I've been working on, for the past 3.5 years to work. And among those kind of soft skills that we learn is kind of as providers, is the practice of bedside patient advocacy, whether that's, pushing for an admission to a service that your patient could benefit from, calling a payer to discuss a prior authorization for a procedure, or even, things like signing a work note. Patients notice the time we take to do these things, and they happen really frequently. And even though they feel small to us, maybe, they can have a big impact for individual patients. Everyone needs forms filled out to get back to work, those sorts of things. And the literature is increasingly pointing towards healthcare-based voter registration as an opportunity to do a little bit of bedside advocacy that can reach outside of the hospital walls and affect change for beyond the individual patient, but for communities. And it's kind of that pitch that drew me to VoteR in 2020. VoteR is a organization that was founded in 2019 with the mission of creating a more healthy democracy to create more healthy communities, kind of stemming from this understanding highlighted by the Venn diagram you see here, and by, I think, all of our speakers so far, that we know that the patients most marginalized by our healthcare system are also most likely to be left out of the political process, detracting from their physical, mental, and civic health in a persistent, pervasive cycle. So I think a lot of us that come to this kind of work are asking ourselves, what can we do to break that cycle? And as I think there are a variety of routes, and I don't know what everybody in this audience does or where you're at in your careers, but I think most of us probably fit somewhere into one of these buckets, maybe. So if you're a healthcare provider, things you can do because you're a trusted messenger, and you also have frequent contact with your patients. So this is something, like we mentioned, DMVs. Not only are 10% of people not having a DMV issued ID, but also not contacting them as frequently, whereas your PCP or your emergency doctor, you might be seeing as frequently as multiple times a year. So your patients look to you for advice, and something you can do is go beyond the exam room with Non-Partisan Tools from VoteR that I think we'll drop a link to. These are designed to help you talk to your patients about their civic health and civic engagement, and keep the focus kind of on being engaged in their community rather than on any particular party or candidate, but just getting them set up to have a voice. If you're in hospital or clinic administration, you can explore the tools that should also be available at that link to help get your workplace equipped to take on the role you're authorized to have, actually under the Motor Voter Act that we talked a little bit about earlier. That's Section 7 of the 1993 MVRA. And in doing so, you can lay the groundwork for your facility to be a leader in this field for years to come. And finally, I think we'll talk a little bit more about these opportunities in the Q&A, but if you're affiliated with a Medicaid program or your state has expanded Medicaid and maybe looking for opportunities like this, you can find out more about how your organization might encourage voter registration activities through Medicaid points of service. Again, kind of leaning into the NVRA and opening up more avenues to make change for our patients and their communities. So thank you for your attention. Keep it pretty brief, just so we can get to the Q&A and go from there. I'll pass it back to, I think, Jessica, you're moderating us, right?
Great. Thanks, Alex. All right. So yeah, I'd love to bring folks in for the Q&A, my esteemed panelists here. Actually, I want to, so there was a question asked about, it was specifically for Adam, and it was about the disabled community in Colorado. But I guess I just want to ask a little bit more about, the disabled community and voting, and what do we know about some of the barriers that this population still faces. Neil, I'm wondering if you can address maybe some of the changes that were made in 2020 because of the pandemic, and but what do we see happening today, how this is affecting the disabled community, and then Dan or Adam, if you have anything to add in terms of the disabled community and how we can encourage more voter registration in this population.
Yeah, I'm happy to get us started with that one. I think when thinking about sort of the modes of voter registration and which modes are accessible to people with disabilities, DMV registration, disabled people are less likely to have a driver's license. They may get a state issued ID. Online voter registration, like I mentioned, is sort of predicated in a lot of states on having that DMV issued ID. Mail registration may be cumbersome for people, for disabled people to sort of print out that form and mail it in. In-person registration similarly may be cumbersome. And so I think in terms of identifying an opportunity to register people to vote, there does need to be sort of a streamlined pathway, and registration through Medicaid does seem to represent that streamlined pathway. And to respond to Jessica's question about sort of how this has improved during the COVID era, I think people are paying a lot of attention to sort of vote by mail and how vote by mail interacts with disabilities, and sort of ensuring that vote by mail is accessible, that people have the opportunity, if they're blind, they can have the ballot read to them through a service provided by the county. There's sort of a long-standing practice of ensuring that there's accessible voting machines at polling places, which are available to people with mobility issues, and that are accessible to people who are blind or deaf. I think what the real revolution that we're seeing right now is how do we carry over that disability access framework to vote by mail, and that's sort of the new area that people are focusing on.
And I would just say, kind of building in on what Neil said, I see it as a core equity issue, that there are individuals for whom the traditional systems of voter registration are a burden and a barrier, and identifying opportunities to overcome those barriers, and leverage the technology that we've been building in our kind of Medicaid program for enrollment just makes sense, and kind of represents from a kind of public policy standpoint, an opportunity to address kind of some of those historical barriers and inequities.
I think from Colorado's standpoint, since we have mail-in voting, every registered voter gets their ballot in the mail, and that can either be mailed back or dropped off at a location site, or people can take it and vote in person on day of, or vote in person on day of. I think we have really pushed to make voting as accessible as possible, but I think to Neil's point, I think there are still some issues that we need to think through on sort of the mail-in voting and how we make sure that that is accessible to folks with particular disabilities, as far as vision and whatnot, who may need some additional support to really take advantage of that mail-in voting system.
Awesome. Thanks so much. Our next question, Dan, maybe you can address this. To pursue Medicaid AVR, does the state need to pass laws to facilitate AVR during the Medicaid enrollment process? Or can CMS navigator organizations and grantees begin incorporating AVR into their process of assisting citizens with Medicaid enrollment? Is engaging in this automatic voter registration justified and protected solely under the NVRA?
So great question. I think there's a few different ways to answer it. And I generally start with, yes, there probably needs to be some level of legislative activity, if for nothing else, to allow automatic voter registration to happen. Right, so there needs to be a legal background for the data transmission that occurs as part of automatic voter registration between agencies and the kind of voter registration authorities. And I think there are some questions about, ensuring that that the data kind of is coming from a verified location, and that the data elements that are necessary for voter registration need to be maintained. So to that end, it's not necessarily something that, say, navigators might be able to kind of immediately do, because there's not necessarily a mechanism for that automatic voter registration to occur. That being said, like, it is kind of, as we're working with states, we kind of recognize that the NVRA allows for and encourages and requires voter registration activities to occur in Medicaid agencies. And, as we're working with states, we're thinking through how the technology is newer technologies that are allowing ways to register folks to vote in a way that kind of wasn't really thought about back in 1993 when the NVRA was written. So I would say, yes, states probably need at least a minimum of an allowance for it to happen. And if I'm being honest, I love Medicaid agencies. They're going to be more willing to work on this and do stuff if their legislature says, hey, this is something you have to do. So there's that level of work as well.
I think just building on Dan's comments. So as I mentioned, we have a pretty robust network of Medicaid and health coverage guides that help people enroll in Medicaid and marketplace coverage in Colorado. Both sort of our Medicaid online system and our marketplace system sort of provide an opportunity to link out and register to vote as part of that process. But it requires sort of those assistance sites to go to another website with that person, have them complete the information in order to sort of go through that process. So it's clunky and frankly not very efficient, and especially during open enrollment, when sort of those health coverage guides are just slammed with appointments trying to get people covered. That's going to fall by the wayside. So automatic voter registration is a much, much more efficient way to approach it.
Thanks both so much. So this is a question along similar lines. I think people are hearing this presentation and saying, oh my gosh, of all of the different, levers that I might have, how can I use it for voter registration? Which is great. That's exactly what we are prompting with this discussion. So the question is, what are the efforts for AVR being integrated into things like medication prescription refills, library cards, marriage licenses? Those activities have similarities to DMV's info gathering that might help in keeping citizens' voter registrations current with their address changes, and also a way to reach people are easy to miss for initial registration. I don't know if Neil or Alex, if you have anything to add.
I have thoughts on this. So I think this is a great point. I think it's important to emphasize that there's really two populations that AVR serves. It's unregistered people and getting them on the rolls, and then there's registered people who AVR can be used to update their information. And I think additional agencies make a lot of sense for that update piece. The problem with adding additional agencies for unregistered voters is you have to ask a question about citizenship in order to register someone to vote. And you don't necessarily want to be adding a citizenship question to every interaction that a person engages in, because that can have sort of a chilling or sort of an intimidating effect on non-citizens. And so one thing that we're looking at is income tax filings as a way to sort of keep voter registration records current. You know, Alex mentioned people interact with their primary care provider more often than they interact with the DMV. In the same way people file income taxes every year, they may renew their driver's license once every 4 to 8 years. So income tax filings may be a way to sort of get updated address information for people who are already on the rolls, but we don't necessarily want to be adding a citizenship question to state income tax forms when it's not there. In the same way, we don't want to be adding a citizenship question to library card applications or things like that. So I'd say there's a real opportunity for other agencies to do updating. I think we have to be careful to not add citizenship questions for agencies to add voters, and focus on the agencies that do already ask that question or verify citizenship as part of the application process, like Medicaid.
Yeah, I would echo those points, that asking for citizenship status is kind of would be a barrier, especially when we're thinking, you know, we've had discussions about, you know, putting these kind of questions on intake forms at primary care offices, those kind of things, you know, kind of automating that process, like we've been talking about, making the easy choice, making the best choice the easy choice, or that kind of thing. But it kind of turned, you know, I think the citizenship is chilling, and building those kind of, like Dan was talking about, the kind of structural basis for automatic voter registration would be hard to build for individual physicians, or even a hospital system, probably.
Great, thanks. All right, I'm going to try to sneak one more in before the buzzer. Could panelists address the recent Texas law that will restrict college students when casting ballots, and ideas on how to engage to ensure that this critical age group register and vote? So knowing that younger voters are more likely to be underrepresented on the rolls, and how do some of these structural changes that we've been discussing, how can that solve that issue?
I can talk about sort of Texas and where it stands and sort of these issues. So Texas is actually worse off than a lot of states because it doesn't have online voter registration at all. Texas is the largest state that doesn't have online voter registration. So people are really limited in their ability to register there. It's mostly either through the DMV or paper registration are the two mechanisms for registering in Texas. Paper registration is, frankly, it's prone to typos. People sort of omit information, or clerks mistype information. It can be very error prone. And so to the extent that we can channel people into the DMV process in Texas, you know, the DMV does cover 90% of people. And that's a way that, you know, it's sort of something that Republicans and Democrats agree on, that as many people as possible should be registered at the DMV, because it's sort of a secure process for registering people to vote. People have to provide all sorts of proof of residency and identity. And so I'd say that in terms of reaching that population, the DMV is sort of the most secure way to register them. And obviously there need to be sort of other opportunities that step up. But I think in Texas, the primary engine of registration is going to be the DMV.
Great. I'm not sure if there's anything else to add to that, but we are just about at time. So with that, I'm sorry we couldn't get to all of your questions. There were some great ones in the chat, and we tried to answer them in the chat if we could, but really encourage you to come to our website, which is healthydemocracy.healthypeople.org. And please, you know, sign up for updates, especially if you're interested in how to pursue these Medicaid AVR policies within your state. And I want to thank all of our fabulous panelists and all of the sponsoring organizations for today's webinar. We will post the recording and the slides on the NASEM event webpage. And really just want to thank everybody for showing up today and for doing your part to ensure that we can include more communities and more people in our democracy and therefore make it healthier. So thank you so much and hope you all have a great day.